recovered.
This segment is sponsored by the American Association of Endodontists. Endodontists are dentists with 2 or 3 additional years of advanced specialty training focused on the inside of the tooth. So if you need help beyond your yearly checkups, an endodontist is someone you might want to consider. Here to give us better insight is Dr. Stephen Katz, president of the American Association of Endodontists. Welcome. Great to see you.
Thank you. Thank you for having me, Elaine.
Of course. Dr. Katz, can you tell us more about how endodontists are different from general dentists?
Well, we are dentists, as you said, and we do have a couple of additional years of training where we focus on the inside of the tooth. But we're actually more than that. We are the tooth-saving specialists. So if patients are in pain, we can help them avoid unnecessary extractions or additional procedures that they may not otherwise need. It's really all about doing what you can to save your natural tooth. And that's what an endodontist does.
So you mentioned if someone's in pain, when are some other times someone should see an endodontist?
Well, if you have swelling, sensitivity to hot or cold, if you've broken a tooth, or if you've had a trauma to your teeth, that's a good time to see an endodontist. However, there's no amount of pain in your mouth that should be considered normal. So if you're not sure, ask your general dentist for a referral, or you could go to findmyendodontist.com and you could find an endodontist in your neighborhood.
Oh, that's a great resource. All right, Dr. Katz, I have to ask you about root canals. Are they really painful, or is that a myth?
Well, that really is one of the biggest myths in dentistry today. Root canals are not at all painful. In fact, they're no more uncomfortable than having a routine filling done. We use new techniques, advanced technologies, and improved anesthetics. The procedure is comfortable, it's quick, and it's pain-free. Really, very often my patients will say to me, I can't believe how easy that procedure was. We like to say this is not your grandmother's root canal.
We love to hear that. That's music to people's ears, comfortable and pain-free. Earlier, you mentioned saving your natural teeth. Why is that better than removing it?
It's always better to save your natural teeth. Nothing looks, functions, or feels like your natural teeth. They're so important for eating, for speaking, and for that all-important smile. But it's really much more than that. We now know that if you take care of your teeth, you can improve your cardiovascular health, reduce your risk for diabetes, and improve cognitive function as we mature. So in short, it's really not just about cosmetics or comfort. It's really an investment in your long-term health and well-being.
Yeah, you mentioned this investment in the long term of having a healthy oral mouth. How can an untreated tooth infection affect our overall health?
Yeah, so there's some really very recent research that shows that if you have an infection in a tooth and you treat it by having a root canal procedure, your cholesterol levels will go down as well as your blood sugar levels. So this means that you can improve cardiovascular health and you can reduce the risk for diabetes. There's still lots of research that needs to be done on this subject. However, it's become incredibly clear that there's such a significant connection between oral health and systemic health. If you're having a problem, you do not want to delay. You want to get to the endodontist as soon as you can.
All right. Dr. Katz, thank you so much. This has been really great information.
Thanks for having me, Elaine.
Sure. For more information, you can head to AAE.org.
I'm John Morgan of Morgan & Morgan.